Imagine this. You take your dog to the vet because he's been acting sluggish, scratching all over, or having digestive issues. The first question the vet asks is, what have you been feeding him? Now imagine you walk into your own doctor's office with the same issues. Low energy, skin problems, and digestive issues. What's the first question they ask? Well, it's not, what have you been eating? It's probably something like, what medication are you on? Or, let's run some tests. Why is it that veterinarians always investigate diet, but conventionally trained doctors rarely do? That's exactly what we're going to dive into today. And by the end of this video, you'll understand why medical training is failing us, why nutrition should be the center of healthcare, and what we can do to change the system, starting with you. But first, let's talk about how veterinarians are actually trained. Veterinarians are taught from day one what an animal eats directly impacts its health, because they don't have the luxury of simply prescribing pills to mask symptoms. They have to figure out the root cause fast. In vet school, they learn about the impact of processed pet foods versus species-appropriate diets, nutritional deficiencies that cause specific illnesses, how diet directly affects metabolism, gut health, and immune function. Now, compare that to conventional training for human doctors. We get years of education on disease pathology, drug treatments, surgical interventions, but nutrition, maybe a few hours or a single elective course. And that's a problem, because like animals, humans are biological creatures. Our bodies respond to food the same way a dog or a cat's body does, yet we're trained to ignore it. Now let's make this crystal clear with a chart. For our vets, it starts with diet history for every patient. They see food as a primary driver of disease and health. They focus on preventing chronic illnesses in pets, and they understand species-specific diets. Well, I was trained as a traditional doc, where I was trained to rarely ask about diets unless patients bring it up. And food was a little bit of an afterthought, secondary to, of course, medication. I was trained to manage disease. And when I ever talked about diet, I believed that it was about a balanced diet. But then I got training in nutrition and functional medicine. And like a good functional medicine doctor, I learned the importance of using diet as a core part of treatment, to see food as medicine, to focus on reversing chronic illnesses, to tailor nutrition to the individual. This was a much better model. And this is the model I practice today in this clinic. So let's ask the big question. Why is it that Fluffy the cat gets a better nutritional assessment than you do? And more importantly, how do we fix this? Let's break it down with a real life example. Case number one, a sick dog. A dog comes into the vet with chronic diarrhea, a dull coat, excessive shedding of it, low energy. The vet immediately considers food allergies, too many processed kibbles, and nutrient deficiencies. Turns out the dog was eating a grain-heavy, low-protein diet. The vet switches the dog to real species-appropriate food, more meat, fewer fillers. Within weeks, the coat is shinier, digestion improves, and the energy is back. Now let's compare this to case number two, a sick human. A person comes into the doctor's office with chronic bloating and indigestion, hair thinning, and fatigue. A conventional doctor may say, let's check your thyroid. Maybe you need iron supplements. Here's an acid reflux medication. But a functional medicine doctor would say, what are you eating? Are you getting enough animal-based protein? How's your gut microbiome? And just like the dog, when we change the diet, symptoms improve. This is the missing piece in medicine. This is exactly why I pursued a master's in nutrition and functional medicine. Because without that knowledge, I'd likely be like every other doctor, treating symptoms instead of fixing the root cause. And that's why I use the NEST and ROPE acronyms to guide my patients. The NEST reminds us to focus on nutrition, what and when you eat, exercise, less stress, more sleep, how you think, and of course having less trauma. The ROPE reminds us to focus on our relationships, avoiding the bad organisms and adding the good ones, pollutants, and protecting our emotions and making sure our life experiences serve us. This is how functional medicine approaches disease, not as a prescription problem, but a lifestyle problem. Wouldn't it be incredible if every doctor thought like this? If every medical student was trained to look at what actually caused the disease instead of just treating symptoms. This is why we need a metabolic health specialty, a new way of training doctors to actually reverse chronic disease. But until that happens, you are in control of your health. So here's what I want you to do. Number one, start thinking like a veterinarian. If your pet gets sick, the first thing you check is their food. Do the same for yourself. Number two, question your doctor. If they don't ask about your diet, bring it up. Challenge them by asking, could this be related to what I'm eating? Number three, keep learning. You're already here, which means you care about your health. Subscribe, follow, and keep growing your knowledge, because no one cares about your health more than you do. And if you found this video eye-opening, share it. Let's start a conversation about why nutrition belongs in medicine, because your health is worth more than a prescription pad. And maybe it's time we stop treating humans worse than we treat our pets.